Now we'll discuss the lower extremity. In the lower extremity, again, you have to follow the same pattern. Most of the times, the muscles asked, they will be superficial muscles. Gluteus maximus is very well dissected in all the specimens of the lower extremity. So please do not identify it as deltoid. So just look at your table on which you are going for the viva, because I have seen many of the students, they are under pressure of the exam. They just make a blunder. They keep telling deltoid muscle on the lower extremity, and deltoid they keep telling gluteus maximus. Okay, so confirm whether it is upper limb or lower limb and answer accordingly. So in the lower extremity, we are having gluteus maximus. Okay. Rarely you will get gluteus medius and gluteus minimus. So those who are preparing for the practical exam, they should first prepare gluteus maximus. And please remember, gluteus maximus, it just not arise from the gluteal surface of the hip bone. It also arises from the sacrotuberous ligaments also. Okay, so it has got an extensive origin. Okay, some part of it arises from the iliac crest also. Okay, lateral slope of the iliac crest also. So prepare the gluteus maximus muscle thoroughly. Next thing, you can get, it is the piriformis muscle. Piriformis muscle, it is a key muscle of the gluteal region. It is key muscle of the gluteal region, and the most thick nerve that you'll confuse with a muscle. Most of the students, they confuse the sciatic nerve for the muscle. So remember, it is almost 1 finger breadth, that is 1.5 to 2 centimeter thick nerve. So whenever you get a thick cord-like structure in the back of the thigh, identify it as sciatic nerve. Okay. So in the gluteal region, prepare two important muscles, that is gluteus maximus, piriformis, their origin and insertion. Okay. Then in the front, when we move to the front, again there are two muscles which are confused if the specimen is very good. One is gracilis and another is sartorius. So as we are discussing the upper extremity, one is coming from the lateral aspect, one is coming from the medial aspect. Similarly, here also sartorius, it will come from the lateral aspect, that is anterior superior iliac spine, and it will cross the thigh and it will insert on the medial aspect on the tibia. Okay? And gracilis, it is coming from the medial aspect and inserting on the medial aspect. So it will come from the pubis and it will insert on the medial surface, upper part of the medial surface of the tibia. So these are the two important muscles that are confused. That is, one is gracilis and another is sartorius. So one should not confuse between these two muscles and prepare their origin, insertion, nerve supply, action. Okay. Very thoroughly prepare origin, insertion, nerve supply, action of sartorius and gracilis. Most commonly asked muscle is sartorius. Okay. So you will get many questions about sartorius. What is the action of sartorius? It will act on which two joints? Okay. Why it is called as Taylor's muscle? So these are the few important questions that have been asked. Then we'll have another muscle, which is a straight muscle, which is going towards the patella. So straight, rectus means straight. So another muscle which is arising from the anterior inferior iliac spine and going towards the patella, it is rectus femoris muscle. Rectus femoris muscle, it is a bipinnate muscle. So nice straight running fibers and bipinnate fascicular architecture is seen. So one should not have any problem identifying or differentiating between sartorius, which is crossing from lateral to medial side, rectus femoris, which is going vertically downwards and inserting on the patella. It is clearly visible. And on each side of the rectus femoris, on the lateral side, we will be having vastus lateralis. On the medial side, we will be having vastus medialis. Okay. So these are the muscles of front of thigh. So we have covered the muscles of front of thigh. So what are these muscles?
Yes.
That is sartorius,
Sartorius,
then rectus femoris, vastus medialis,
yes,
and vastus lateralis.
yes,
Okay.
yes,
So collectively, the rectus and three vasti. We haven't discussed vastus intermedius because it is under the rectus femoris. It is under the rectus femoris. So this vastus intermedius, lateralis, medialis, along with the rectus femoris, these are called as quadriceps femoris.
quadriceps,
So under the pressure of the exam, most of the students they utter the name quadratus femoris. Okay.
yes, yes,
So remember, so don't make a mistake naming the muscle. It is quadriceps femoris, four muscles, and quadratus femoris, it is a muscle of gluteal region. It is a small muscle of the gluteal region.
yes,
It is inserting on the quadrate tubercle posteriorly on the femur. So we have finished front of the thigh. We know
yes, sir.
all the muscles of front of thigh, they will be supplied by femoral nerve. Okay. Femoral nerve, it is a nerve supply of front of thigh muscles. So you expect the questions, root value of the femoral nerve, whether it is arising from the dorsal or ventral division. Okay. So femoral nerve, it is arising from the dorsal division. In the thigh, the front of thigh muscles, these are mainly extensor muscles. Okay. And in upper extremity, the front of arm muscles, these are mainly flexor muscles. So the compartments, they change in upper extremity and lower extremity. So this you have to keep in mind. Okay.
Yes.
Next is back of thigh muscle. Back of thigh muscle, these are muscles arising from the ischial tuberosity mainly. Okay. So we are having semimembranosus, semitendinosus, which are going on the medial aspect, and one muscle that is the long head of biceps. Long head of biceps femoris. Okay. Adductor magnus, it is a deep muscle. Adductor magnus, it is a deep muscle. So mostly you will get the muscles that is semimembranosus, semitendinosus. Okay. And long head of biceps femoris. In these three muscles, you have to differentiate. Similarly, the muscle which is going towards the lateral side, it will be biceps femoris. The muscle which will be going towards the medial side, these will be semimembranosus and semitendinosus. Now, how to differentiate between semimembranosus and semitendinosus? It is the semimembranosus, it is going from posterior aspect, that is from ischial tuberosity to the posterior aspect only, whereas the semitendinosus, it is crossing from posterior aspect to the front. It is going on the medial surface, upper part of the tibia. Along with the sartorius, gracilis, the semitendinosus goes. So there is a difference in the insertion between semimembranosus and semitendinosus. Looking at these insertions, we have to identify the muscles. So first of all, we will differentiate between the muscle which is going laterally and which is going medially. And on the medial side, we will differentiate by their insertion, the muscle which is inserting on the back and the muscle which is inserting on the medial side of the shaft of the tibia. So these are three muscles, that is long head of the biceps femoris, semimembranosus and semitendinosus. Then you have to prepare for the questions, that is guy rope muscles. So guy rope muscles, all the characteristics, why these muscles are called as guy rope muscles, why short head of biceps femoris is not included as guy rope muscles. These are the questions. Okay. On the adductor magnus, you will get the question like why, what is composite muscle, what is hybrid muscle, isn't it? So what are the other hybrid muscles? These are the questions. Once you pass the hurdle of basic questions, these questions come. So to give the further markings to the students, the examiner will ask what is composite muscle in the upper extremity, in the lower extremity. So just note it down and make a list of what is composite muscle, what are various composite muscles. Next thing, we'll discuss the muscles of leg, that is front compartment and posterior compartment and lateral compartment. So here we have to focus on the leg. That is, in the leg there are three compartments. In the thigh there are three compartments. Okay. In the arm there are two compartments. In the forearm there are two compartments. In the thigh there are three compartments. In the leg there are three compartments. So this is the basic structure that we should keep in mind always, and we should have a proper orientation of the nerves of these three compartments. Most of the times anterior compartment, posterior compartment and lateral compartment, इनकी nerves पूछी जाती है ज्यादातर, और स्टूडेंट्स कंफ्यूज कर जाते हैं. एंटीरियर कंपार्टमेंट के लिए हमारे पास डीप पेरोनियल नर्व है, लैटरल कंपार्टमेंट के लिए हमारे पास सुपरफिशियल पेरोनियल नर्व है, और पोस्टीरियर कंपार्टमेंट के लिए हमारे पास टिबियल नर्व है. तो ज्यादा ब्लंडर्स टिबियल नर्व एंटीरियर कंपार्टमेंट में बताई जाती है ज्यादातर स्टूडेंट्स के जरिए, तो ये मिस्टेक नहीं होनी चाहिए. एंटीरियर कंपार्टमेंट की नर्व है डीप पेरोनियल, लैटरल कंपार्टमेंट की है सुपरफिशियल पेरोनियल, और पोस्टीरियर कंपार्टमेंट की है टिबियल नर्व. तो एंटीरियर कंपार्टमेंट में अगर हमें मसल देखने हैं तो जाहिर सी बात है एंटीरियर कंपार्टमेंट का दूसरा नाम हमको याद रखना होगा. एंटीरियर कंपार्टमेंट इज ऑल्सो known as extensor compartment in the lower extremity. So there will be one muscle that is tibialis anterior, digits को जाने वाली, that is extensor digitorum longus muscle, और great toe को जाने वाली extensor hallucis longus muscle. So if you have a clearly and neatly dissected specimen, you will not have any problem. Tibialis anterior, it will go up to the base of first metatarsal. ठीक है, it will go up to the base of first metatarsal, and then we have the digitorum muscles which will go up to the digits. So extensor digitorum longus, and hallucis, it will go up to the base of great toe. ठीक है, the distal phalanx of the great toe. So there should not be any problem. The muscle which is seen in the front of the leg, but it is present on the lateral side, and in front of the lateral malleolus, it is the peroneus tertius muscle. ठीक है, it is peroneus tertius muscle. Posteriorly we are having the long muscles which are going to the digits, like the flexor digitorum longus, isn't it? Then the muscle going towards the navicular tuberosity and rest of the tarsals except talus, that is tibialis posterior muscle. ठीक है, tibialis posterior muscle. So these muscles we have to revise in front of the medial malleolus and behind the medial malleolus, and in front of the lateral malleolus and behind the lateral malleolus. You have to remember 4 tendons. ठीक है, so these 4 tendons you should read thoroughly, their origin, insertion, nerve supply, action. ठीक है, in front of the medial malleolus there will be tibialis anterior, behind the medial malleolus there will be tibialis posterior. So how will you confirm between the medial and lateral? By looking at the great toe and the little toe. So these are very basics. So look at the patella, so that we should not confuse between the front and back compartment. Then look at the great toe and little toe, so that we can easily remember the medial side and lateral side. Okay. So on the medial side, on the front, we are having the tibialis anterior, and behind we are having tibialis posterior. On the lateral side, in front of the lateral malleolus, we are having peroneus tertius, and on the lateral side, behind the lateral malleolus, we are having peroneus longus and peroneus brevis. These 2 muscles behind the lateral malleolus. So these are important things that we should remember. And these peroneus longus and peroneus brevis, these are muscles of lateral compartment. If asked, their nerve supply is, we have already discussed, their nerve supply is superficial peroneal nerve. Okay. So we should remember these muscles by 2 compartments, and they are 2 different names. That is, front compartment is also known as anterior and extensor. Posterior compartment is also known as the posterior compartment or flexor compartment. Okay, so the name of the muscles, they should be told accordingly. So posterior compartment की muscle आपसे पूछी है, तो either there will be a tibialis anterior muscle and flexor digitorum longus muscle, flexor hallucis longus muscle. ठीक है, so these are deep muscles, but their tendons are visible behind the medial malleolus. ठीक है, but What about the superficial most muscles that are forming bulk? Okay. So these muscles are gastrocnemius muscle and soleus muscle.
Yes.
Okay. So look carefully for the two heads of the gastrocnemius. Okay. Most of the times in some specimens, these muscles, these two heads, they have been cut in the middle to show the underlying soleus. So we should look carefully whether there are two heads coming from the two sides of the femoral condyles. Okay. So there will be gastrocnemius muscle, and if the muscle is not crossing, a bulky muscle which is not crossing the knee joint, it will be soleus muscle, because soleus, it will arise from the soleal line of the tibia posterior. So the muscle which is crossing the knee joint, they will be gastrocnemius. Muscle which is not crossing the knee joint, it is soleus muscle. Okay. And popliteus, it is not clearly visible in most of the specimens. So I don't think anyone will point out the popliteus muscle. Rarely you will get a question on identification of the popliteus, but popliteus is an important muscle from the locking and unlocking point of view. So we should prepare popliteus muscle thoroughly, and we should not forget its origin is from lateral condyle of the femur and not from the popliteal surface of the femur. So the most common mistakes students make, it is the origin of the popliteus. They immediately say popliteal surface of the femur. It is not the popliteal surface of the femur, but it is lateral condyle. It is from the lateral condyle. It is having a tendinous origin and a fleshy insertion. So these words are important when we are describing popliteus muscle. It is having a tendinous origin and a fleshy insertion above the soleal line. Okay. And the next important thing we should know about the popliteus muscle, that its nerve supply is a branch from the tibial nerve, that is a popliteal nerve. Next, it is attached to the lateral meniscus. Okay. So that whenever it is forming the unlocking of the knee joint, it pulls the lateral meniscus. That is why the lateral meniscus is most commonly prevented from the injury, and medial meniscus is most commonly injured. So these are basics of the back of the leg. In the front of the leg, we should not miss the ligamentum patelli. Most commonly asked question. Patella के नीचे जो tendonous part होगा, that will be ligamentum patelli. Okay. So ligamentum patelli, it is a tendon of quadriceps femoris muscle. And next commonly asked question is why it is called ligament. Is it a ligament or it is a tendon? So it is basically a tendon of quadriceps femoris muscle, and ligamentum patelli, it is a misnomer. So the practical examiners, they want to hear this terminologies, that it is a misnomer. So one should remember that ligamentum patelli, it is a misnomer and it is a tendon of quadriceps femoris. And at the same time, we should remember patella, it is a sesamoid bone. So the viva may go on the sesamoid bone. So one should not skip sesamoid bone and its characteristics. So those who are noting down, please note down the sesamoid bone. It is important from viva point of view also in soft part table as well as on the hard part. So patella, it will be obviously asked to one or other student. I think we have covered the extremities very well.